You've probably heard the terms premature ejaculation and erectile dysfunction thrown around, and often they are used interchangeably. But here's the truth. These are two distinct conditions that require different approaches to treatment. Both premature ejaculation and erectile dysfunction can affect your confidence, intimacy, and overall well-being. However, they stem from different causes and involve different areas of the body. So, why do these terms get mixed up so often? The confusion likely arises because both involve difficulties during sex, and many men experience one or both at the same time. However, while the symptoms may overlap, the causes and solutions are unique. I'm Dr. Stacy Loeb, a board-certified urologist with over 15 years of experience helping men restore their sexual health. Today, we're going to clear up the confusion between premature ejaculation and erectile dysfunction and help you understand exactly what's happening in your body. By the end of this video, you'll know the key differences between these two conditions and how you can take control of your health and your confidence, with the right treatment tailored specifically to you. Premature ejaculation, P, and erectile dysfunction, ED, are two of the most common sexual health issues men face, and they're often mistaken for one another. While both involve challenges related to sexual performance, their causes, symptoms, and treatment approaches are quite different. Premature ejaculation, P, occurs when a man ejaculates earlier than desired during sexual intercourse, typically within 1 to 2 minutes of penetration. This can be frustrating and lead to a sense of loss of control, both for the individual and their partner. PE can happen at any age, but is often linked to heightened sensitivity in the penis, anxiety, and a lack of control over arousal. The good news is that premature ejaculation is largely treatable through behavioral techniques, such as the stop-start method or the pause-squeeze technique, as well as mindfulness, relaxation exercises, and pelvic floor strengthening. These treatments address the reflex loop that controls ejaculation, offering natural solutions to improve timing and control. On the other hand, erectile dysfunction, ED, involves the inability to achieve or maintain an erection firm enough for sexual intercourse. ED is typically caused by underlying physical issues, such as poor blood circulation, hormonal imbalances, or nerve damage. It's more common as men age, particularly due to conditions like heart disease, diabetes, or low testosterone. ED can also have psychological causes, including stress, depression, or relationship issues. Treatment for ED typically involves medications such as PDE5 inhibitors, Viagra, Cialis, lifestyle changes, or therapy to address psychological factors. In some cases, devices like vacuum pumps or injections may be recommended. Understanding the difference between PE and ED is crucial because treating them with the same approach won't yield the best results. Both require different solutions tailored to their causes, physical treatments for ED and behavioral interventions for PE. The first step toward improving your sexual health is knowing which condition you're facing and addressing it with the appropriate method. By learning about the differences between premature ejaculation and erectile dysfunction, you can begin the journey toward the right treatment. Understanding what's going on in your body allows you to make informed decisions and take effective action, ultimately improving your confidence and overall well-being. Premature ejaculation, P, and erectile dysfunction, ED, are often confused because both involve sexual performance issues. However, while they share some symptoms, they have distinct causes and require different approaches to treatment. PE occurs when a man ejaculates too quickly, often before or shortly after penetration, which can lead to frustration and dissatisfaction for both partners. This is often linked to psychological factors like anxiety or physical factors like pelvic floor muscle tension or nerve sensitivity. On the other hand, ED is the inability to achieve or maintain an erection sufficient for intercourse. This condition is more often related to physical causes such as poor blood flow, hormone imbalances, or nerve damage, but can also be influenced by psychological stress. Understanding the key differences between PE and ED is crucial for finding the right treatment. While PE may benefit from techniques like mindfulness, breathing exercises, and pelvic floor training, ED often requires treatments that address underlying physical issues, such as medication or lifestyle changes. Premature ejaculation, P, causes, treatment, and solutions. Definition: premature ejaculation, P, is a condition where a man ejaculates sooner than he or his partner would like, usually within 1 to 2 minutes after penetration. While PE can occur occasionally in many men when it becomes a regular issue, it can affect self-esteem, cause relationship stress, and lead to anxiety. Causes: psychological factors. Anxiety, stress, and performance pressure are among the most common psychological triggers for PE. When a man becomes anxious about his performance, his body's natural response is to release more adrenaline, which can speed up ejaculation. This cycle creates a pattern that becomes hard to break. Performance anxiety is often linked to negative thoughts, concerns about partner satisfaction, or fear of not meeting expectations. Physical factors: overactive pelvic floor muscles. If the pelvic muscles are overly tense or don't function correctly, this can lead to early ejaculation. These muscles are responsible for controlling ejaculation, so their improper functioning can reduce control. Hypersensitivity of the nerves. Some men have heightened sensitivity in the genital area, which can cause ejaculation to occur more quickly. Hormonal imbalances. Imbalances in hormones, such as low levels of serotonin, can disrupt the body's ability to delay ejaculation. These imbalances can be caused by stress, depression, or other underlying health conditions. Treatment: behavioral techniques. One of the most effective ways to manage PE is through behavioral therapy. These techniques help the brain and body communicate better, allowing a man to gain more control over ejaculation. Breathing exercises. Relaxing deep breathing exercises help activate the parasympathetic nervous system, reducing the anxiety and physical tension that often contribute to premature ejaculation. Mindfulness. Staying present and focusing on the sensations during intimacy, instead of rushing toward orgasm, can help break the cycle of early ejaculation. Mindfulness techniques teach men to pay attention to the experience rather than thinking about performance. Pause squeeze method. This method involves stopping sexual activity right before ejaculation and applying pressure to the base of the penis for several seconds. This can help prevent climax and give the man more time to control the situation. Pelvic floor training. Strengthening and relaxing the pelvic muscles can improve ejaculatory control. Kegel exercises, which involve contracting and relaxing the pelvic muscles, can help build muscle strength, enhance endurance, and improve ejaculation timing. Training the pelvic floor can result in better control during intimacy and can address any muscle tightness or weakness that may be contributing to premature ejaculation. Medications, topical numbing agents. These creams or sprays reduce sensation in the penis, allowing a man to delay ejaculation. They should be used sparingly, as they can affect the sensitivity of both partners. Selective serotonin reuptake inhibitors, SRI. These antidepressants are often prescribed off-label to treat PE. They help increase serotonin levels, which may delay ejaculation and reduce performance anxiety. SRI, such as paroxetine, fluoxetine, and sertraline, are commonly used for this purpose. Conclusion: premature ejaculation is a treatable condition. With the right combination of behavioral techniques, pelvic floor training, and in some cases, medication, men can regain control and enjoy more satisfying and fulfilling sexual experiences. It's important to remember that PE is common, and seeking help from a healthcare provider or urologist can lead to effective solutions. Erectile dysfunction, ED, causes, treatment, and solutions. Definition: erectile dysfunction, ED, refers to the inability to achieve or maintain an erection firm enough for sexual penetration. While occasional difficulty in achieving an erection is common and normal, chronic ED can significantly impact a man's self-esteem, relationships, and overall quality of life. ED is more prevalent as men age, but it can affect men of all ages. Causes: physical causes, reduced blood flow. Conditions like atherosclerosis, diabetes, and hypertension can cause the arteries to narrow, reducing blood flow to the penis. Blood flow is essential for achieving and maintaining an erection, and when blood vessels are compromised, erectile function can suffer. Obesity. Excess body weight can contribute to the development of cardiovascular diseases and diabetes, both of which are major risk factors for ED. Nerve damage. Nerve damage from surgeries, injuries, or conditions like multiple sclerosis or Parkinson's disease can also interfere with erectile function. Hormonal causes. Low testosterone. Testosterone is a key hormone for sexual function, and a decline in its levels can lead to reduced libido and difficulty achieving an erection. Other hormonal imbalances. Conditions like hypothyroidism or prolactinoma, elevated prolactin levels, can also contribute to ED by affecting hormone levels that influence erectile function. Psychological causes. Stress and anxiety. Psychological factors are significant contributors to ED. Anxiety about performance, stress at work, or financial worries can interfere with sexual arousal and function. Depression. Low mood and depression can impact interest in sex, leading to a lack of arousal and difficulty getting or maintaining an erection. Depression is often linked to both hormonal and neurotransmitter imbalances. Relationship issues. Emotional connection with a partner can play a significant role in erectile health. Relationship stress or unresolved conflict can negatively impact a man's ability to perform sexually. Treatment. Lifestyle changes. Diet. A heart-healthy diet rich in fruits, vegetables, lean proteins, and whole grains can improve overall cardiovascular health, which is directly linked to better erectile function. Foods like beets, spinach, and salmon, which are rich in nitric oxide precursors, help dilate blood vessels and improve blood flow. Exercise. Regular physical activity can improve blood circulation, reduce stress, and boost hormone levels, all of which contribute to better erectile function. Aim for at least 30 minutes of moderate exercise most days of the week. Sleep. Adequate, restful sleep is crucial for hormone regulation and maintaining energy levels. Chronic sleep deprivation can lower testosterone levels and exacerbate ED. Medications. Phosphodiesterase type 5 inhibitors, PDE5 inhibitors. Medications like Viagra, sildenafil, Cialis tadalafil, and Levitra vardenafil are commonly prescribed to treat ED. These medications work by increasing blood flow to the penis, allowing for an erection to occur with sexual stimulation. Testosterone therapy. In cases of low testosterone, hormone replacement therapy may be prescribed to restore normal levels and improve sexual function. Therapy. Cognitive behavioral therapy, CBT, or couples counseling can help if psychological factors are contributing to ED. These therapies help address the underlying causes of stress, anxiety, or relationship issues that may be affecting sexual performance. Psychosexual therapy. Specialized therapy aimed at treating emotional or mental health issues related to sexuality can help men regain confidence and overcome performance anxiety. Conclusion. Erectile dysfunction is a treatable condition, and with the right combination of lifestyle changes, medication, and therapy, most men can see significant improvement. The key is addressing both the physical and psychological factors that contribute to ED. If you're experiencing ED, it's important to consult with a healthcare provider to identify the cause and start an appropriate treatment plan. While premature ejaculation, P, and erectile dysfunction, ED, are both sexual performance issues, they focus on different aspects of sexual health. PE is about ejaculation timing. It happens too quickly, typically within minutes of starting intercourse. Men with PE can still achieve an erection, but they struggle to control when they ejaculate, often leading to frustration and anxiety. ED, on the other hand, is about erection quality. It refers to the inability to achieve or maintain an erection firm enough for sexual activity. Men with ED may have difficulty getting an erection at all, even if they don't have issues with ejaculation timing. In short, PE affects the timing of ejaculation, but men can still get an erection. ED affects the ability to get or maintain an erection, regardless of ejaculation timing. Understanding these key differences helps in finding the right treatment. Men with PE benefit from behavioral techniques and pelvic floor exercises, while those with ED may need lifestyle changes, medications, or therapy. If you find that premature ejaculation is affecting your quality of life, relationships, or causing distress, it's important to seek help from a healthcare professional. Here are some signs that you may want to consider seeing a urologist or therapist. Frequent, ongoing premature ejaculation. If you consistently ejaculate too quickly during intercourse, and it's causing frustration, anxiety, or relationship issues, it's time to seek help. Performance anxiety. If the fear of premature ejaculation is affecting your ability to relax or enjoy intimacy, a therapist who specializes in sexual health may help. Difficulty with control. If you're unable to delay ejaculation despite trying various methods, a professional can assess your situation and offer solutions. Treatment options often include behavioral techniques, methods like the pause-squeeze technique, stop-start method, or mindfulness-based therapy have proven to be very effective in delaying ejaculation. Pelvic floor exercises. Strengthening and relaxing the pelvic muscles through Kegel exercises can improve control over ejaculation by balancing the muscle tone in the pelvic region. If you've been struggling with premature ejaculation for a while and haven't found relief, a urologist or sexual health specialist can guide you through an individualized treatment plan tailored to your needs. Erectile dysfunction is often a symptom of underlying physical health conditions. If you're experiencing ED, it's important to seek a comprehensive evaluation to understand the root cause. This may include tests to rule out or manage conditions that could be contributing to the issue. Get a full health checkup. ED can be a sign of cardiovascular disease, diabetes, or high blood pressure. If you have any of these conditions or a family history of them, it's essential to get evaluated. Hormonal testing. Low testosterone and other hormonal imbalances can cause or worsen ED. Your doctor can perform a blood test to assess your hormone levels. Lifestyle review. Factors like smoking, alcohol use, poor diet, and lack of exercise can contribute to ED. A comprehensive evaluation will help determine the most effective treatment plan. Treatment options for ED often include medications, phosphodiesterase type 5 inhibitors, PDE5 inhibitors, such as Viagra, Cialis, or Levitra, are commonly prescribed to improve blood flow and help men achieve and maintain an erection. Lifestyle changes. Improving diet, exercise, and sleep can help restore blood flow and balance hormones, often improving erectile function naturally. Therapy. If psychological factors like stress, anxiety, or depression are contributing to ED, cognitive behavioral therapy, CBT, or counseling with a sexual health therapist can be very helpful. Clinical tip. It's important to note that PE and ED can overlap, and one condition can often make the other worse. For example, anxiety about not maintaining an erection might cause a man to rush toward ejaculation, while premature ejaculation can add to the stress of trying to maintain an erection. If you're experiencing both, addressing both issues simultaneously with a comprehensive treatment plan will be more effective. With the right approach, both conditions can be managed, improving overall sexual health and quality of life. By seeking help early, you can prevent these issues from affecting your relationships or self-esteem in the long run. Don't hesitate to reach out to a healthcare provider who specializes in sexual health. They can guide you through the best treatment options for your unique needs. Premature ejaculation, P, and erectile dysfunction, ED, are distinct conditions, but both are highly treatable. If you're dealing with either or both, it's important to know that effective solutions are available. These might include lifestyle changes, such as improving your diet, exercise, and sleep, behavioral techniques like breathing exercises and pelvic floor training, or medications like PDE5 inhibitors and SRI. You don't have to suffer in silence. Both PE and ED are manageable with the right approach. Seeking professional help and following a personalized treatment plan can restore confidence and intimacy. If you found this video helpful, subscribe for more tips on men's health and sexual wellness. And don't forget to share this video with someone who might benefit from understanding the difference between PE and ED. Help is available, and you don't have to go through it alone.